Hello everyone, my name is Dr. Aditya Sharma. Today we discuss the topic Covid-19 viral disease. It is also known as Wuhan virus, novel coronavirus 2019, Covid-19 virus, SARS-CoV-2, that is severe acute respiratory syndrome coronavirus 2. COVID-19 mainly caused by the SARS virus, which belongs to the family of coronavirus. The word corona is a Latin from crown. Coronaviruses is a broad family of viruses named after the crown like spikes on their surface. जो कोरोना वायरस होता है उसके जो सरफेस होता है उसके ऊपर स्पाइक्स होते हैं, स्पाइक्स ऑन देयर सरफेस. So it is like a crown shape. They typically caused mild to moderate upper respiratory tract infection in humans, but can also cause more severe infections such as pneumonia and other lower respiratory tract infections. COVID-19 is caused by the SARS-CoV-2 virus, which belongs to the coronavirus family. COVID-19 can cause mild to severe respiratory illness, including death. Next is type of coronavirus. The coronavirus is a virus family that can cause a lot of illness that are mild to life-threatening. It is a cousin of both Middle East Respiratory Syndrome, that is MERS virus, more popular severe acute respiratory syndrome SARS viruses. There are the only 7 strains of coronavirus that are known to cause illness in human beings. First is human coronavirus 229E. It is alpha coronavirus. Second is human coronavirus OC43. It is beta coronavirus. SARS coronavirus. It is a beta coronavirus. Fourth is human coronavirus NL63. It is a alpha coronavirus. It was first reported in the Netherlands. Fifth one is HKU1 coronavirus. It is a beta coronavirus. It was originated in the Hong Kong. Sixth one is MERS-CoV-2. It is a beta coronavirus. Seventh is SARS-CoV-2. It is a beta coronavirus. It has been reported in 2019 from the Wuhan, China. Next is the mode of transmission of the COVID-19 or coronavirus. Human coronavirus spreads from the one person to another. First is from through the droplets released in the air when the patient coughs or sneezes. Second, by touching an object that may have a virus on it, and then touching your eyes, nose, or mouth without washing your hands. Third one is through close personal contact such as handshake. In the rare cases, through fecal contamination. These are the mode of transmission of the coronavirus. Next is the clinical manifestations of the coronavirus. The signs and symptoms of the coronavirus may appear 2 to 14 days after the exposure. This time after exposure before having symptoms is called incubation period. Patient can still spread COVID-19 before she have symptoms. The common signs and symptoms include fever, cough, and tiredness. These are the common symptoms of the coronavirus. The early symptoms of COVID-19 may include loss of taste and smell. The other symptoms can include shortness of breath or difficulty breathing, muscle ache, chills, sore throat, running nose, headache, chest pain, pink eyes, that is conjunctivitis, nausea, vomiting, diarrhea, and rash. These are the other symptoms of the coronavirus disease. Next is how to diagnose the coronavirus. There are a variety of tests for detection of the coronavirus. First is swab test. In the test, special swab is used to scrape a sample out of the nose or throat of the individual. Second one is RT-PCR test. Real-time RT-PCR is one of the most commonly used laboratory methods for identification of the COVID-19 viruses. This test is method of nuclear detection of identify the presence of unique genetic material in the virus. Second is nasal aspirate. In this case, a saline solution will be injected into your nose and then sample is taken with the light suction. Next is tracheal aspirate. In this case, a thin tube with torch, also known as the bronchoscope, is put into your mouth to reach your lungs from where sample is collected. Next is a sputum test. Sputum is thick mucus that get accumulated in the lungs and comes out with the cough. During this test, you are required to cough up sputum in a special cup or a swab. It is used to take a sample from your nose. Sixth and last test is blood test. In this case, blood sample is taken from the vein in the arm. Next is treatment of the coronavirus. First is non-pharmacological treatment. First is wash your hands. Clean your hands frequently with a soap and hot water, or use an alcohol-based hand rub containing at least 60% of the alcohol. Next is wear disposable gloves. If you have contact with person body fluids or feces, wear disposable gloves. Throw the gloves away immediately after use and wash your hand thoroughly. Next is wear a surgical mask. When you are in the same room as a person with SARS, cover your mouth and nose with surgical mask. Wearing eyeglasses also may offer some protection. Next is wash personal items. Use soap and hot water to wash utensils, towels, bedding and clothing of someone with a SARS. Next is disinfect surfaces. Use a household disinfectant to clean any surface that may have been contaminated with a sweat, saliva, mucus, vomit, stool or urine. Wear disposable gloves while you clean or throw the gloves away from your done. Next is Covid-19 vaccination. Next is pharmacological treatment. Pharmacological treatment first is nirmatrelvir with ritonavir. These are the antiviral drugs. It is an investigational antiviral treatment. It is taken at the home by mouth. It should be started as soon as possible. Must begin within the 5 days of when your symptoms start. Next is remdesivir. It is an antiviral treatment used in adults and children. The treatment requires intravenous infusion at the healthcare facility for 3 consecutive days. It should be started as soon as possible. Must begin within 7 days when your symptoms start. Next is bebtelovimab. It is an investigational monoclonal antibody treatment used in adult and children ages 12 years and older. Next and last is molnupiravir. It is an investigational antiviral treatment used in adult ages 18 years and older. These are all about the treatment, diagnosis, clinical manifestations, and the mode of transmission of the COVID-19 virus disease. Thank you, everyone.